screen now?
Yeah.
Okay, perfect. So what we will be doing today is the physiology of exercise. Did you guys read anything on it, or do you guys have any idea? Is it all muted or something?
Okay, guys. So this is not a lecture; it's an interactive seminar. So we want you to answer to us. You know, no camera, just a microphone. You know, just your voice, like discussion, like we do every week.
Yeah, just say something, because that's how I know you guys are at least listening, and my mic is not muted or something like that. Okay, so anyway, we'll start with the presentation. So this is how the presentation is divided. The part one is where we will discuss about the definition. We'll discuss about these, because so the reason we are going directly to the systemic values and the the response to the exercises is because, well, in exercise physiology, there is not much directly related to the final exam. So what we will use this as a method to revise and also revise our previous knowledge on the cardiovascular, respiratory system and the rest of them, and also at the same time connected to the exercise physiology. So that's why we're going to review the normal values and then learn about the values of the during exercise, and then at the same time in the end we'll discuss about O2 det and also epoch. So does anyone know what is the definition of exercise physiology? Any idea? If you guys don't know, you can just say no and I'll continue.
At least I know. I'm waiting. At least I know.
I guess exercise is basically when you have activity which involves muscle contraction or joint flexion or extension, and it places like stress on body's organ systems.
Yep, that's a good definition. So basically, yeah, you're right in what. So what happens is that the during exercise there are certain stresses, and these stresses cause the body to produce an acute response, which what we were supposed to study during the practical. What we were, if the practical were to had happened, we would have actually been able to see these acute responses. But also at the same time, there are chronic adaptations as well to it. And today we'll expand on the acute responses of exercise physiology. So okay, we're going to first go to the respiratory system and we're going to discuss the normal values and the values during exercise. So first we'll go to minute ventilation. Does anyone know the definition of minute ventilation or the formula or anything? Okay, so what minute ventilation is? Well, it is the amount of air that moves in and out in 1 minute. Does anyone know any values of rest or at maximum of minute ventilation? At rest, you guys should know minute ventilation. Any idea?
It's roughly 8 liters per minute, right?
Right. Around 6 to 8. Yeah, right. Depends on the person, but yes, 6 to 8 would be right. So do you guys know how much can it increase until? Like, what is the maximum we can push our minute ventilation to?
Roughly 20 times.
Yep, exactly. Around 20 times. And we also have something called a breathing capacity. Well, breathing capacity is some kind of is a capacity after we reach this maximum. It serves as a protection for our lungs, and the value of this is around 150 to 170 liters. You don't have to remember it, but it's to just to know it if you ever are asked this value. Okay, so what is O2 consumption?
What does it mean again, the breathing capacity?
So it's the capacity. So if your lungs were, if you were to breathe more, if you had to breathe more than 120, this is the maximum your lung can possibly handle. You would not be able to reach the 20 time the 150 unless and until there is very intense dire need. So you're
I was going to say, basically, for every organ, there is some reserve capacity. For example, if you need some extra load, it can actually reach that load, and there is also some extra for it. For example, in the kidneys, they work at 10%, I think. So if you remove one kidney, the other one is enough. It has enough capacity for your whole needs. Or for the lung, for example, if you remove a segment of the lung, the rest of the lung has enough capacity to make up for the loss. So the lung usually is 120 is where you are going to have your max capacity. However, the breathing capacity is more than that. This is called reserve capacity, and it's the final lecture in the summer semester. So basically, each organ has the ability to do more work than is needed by the body. Some organs have more capacity, some other organs don't have capacity. For example, in the brain, you cannot remove the brain. And okay, the brain is a bad example. But for example, the heart, you cannot remove the heart and your body will keep going on. But for the liver, you can cut the liver. For the kidney, you can remove the kidney. For the lung, you can cut the lung. And there is still enough capacity for you to do your needs. So that's the capacity.
If it's absolutely necessary, your lung can reach this capacity. But if you were to exercise, you would not be able to reach the breathing capacity, but you would reach the maximum capacity of around 120 liters.
Okay. Just one question.
Yeah, no problem. Yeah,
I don't know if I confuse people. Did I confuse people more, or everyone is okay with my explanation?
I got it, but the breathing capacity mentioned here is for both lungs, yeah?
Yes.
Together, and it's not for.
No, it's per each lung. Otherwise, it doesn't make sense.
Yes, because each lung. You're right. Because 6. So we multiplied the 6 with 120. Yeah. So the 6 liter minute ventilation is of. Wait a minute. Minute ventilation is of.
It should be for both lungs.
Both lungs, because minute ventilation is tidal volume into the respiratory rate. Yeah.
But then if you remove one lung, you're never gonna reach 150 or 70, no? Or what?
But,
yes. This is just for both lungs, for normal healthy humans. If you have some disease of lungs, of course it will be lower.
So how
we're
much
always talking about we're always talking about male 60 kilograms 20-year-old, something like this. We always talk about this subject. No female, no old people, no disease.
So like if you remove one lung, yes, so how much will be the breathing capacity then?
All the numbers will be halved or lowered.
Yeah,
half or lowered.
So the breathing capacity is like a protection mechanism that in case that the maximum capacity is not enough, there's still a chance.
Your lungs doesn't just burst or just doesn't die. It's some little bit extra capacity to even go above it if absolutely necessary.
Yeah, okay, thanks.
No problem. Do you guys know what is oxygen consumption, VO2? Well, it's the volume of oxygen that is consumed by the entire body in 1 minute. And we have the values over here. So values at rest, normal consumption is around 250 ml, and it can be different for different people, because if you are trained and if you're a marathon runner, your at rest value can be very high. And if you were, and for that same person, if he were to exercise, it would be at least 10 times more. So for a normal person, it can reach up to at least 3.5 liters, so 10 times approximately the normal value. You can increase your oxygen consumption by around 10 times. Okay, Okay, so do you guys know what is RER and RQ, respiratory exchange ratio and respiratory quotient? Any idea?
The respiratory exchange ratio is the ratio between the amount of CO2 produced in metabolism and the oxygen used.
Right. And what about the RQ then? RER is both of them actually are the, so what both of them are actually, what you said is right. Both of them are actually the CO2 that is expelled or used up, produced in the metabolism divided by the O2 consumed. But the only difference is that the RQ is, so the oxygen that is present is, so oxygen levels are measured in the blood for RQ, making it more accurate compared to the RER, in which the oxygen is measured in the expelled air. Do you understand the difference?
Yeah.
Okay. So what both?
So this is the. Sorry.
Yeah, no, go ahead. Tell me.
So the difference between RQ and RER, it's just the way to measure.
Yes, it'll be more
Okay.
because you cannot measure. It will be well, in spirometry. If you had done the practical, you would have measured it with the air expelled by the mouth. It's unnecessary to measure the RQ because you will have to, well, go invasive. This is just an representation of a more accurate method if you were to need it. But that's what they both of
Okay,
them
now
are
it's
used for.
clear.
Yeah, and both
Thank
of,
you.
no problem, no problem. So both of these values are actually used for measuring the kind of substrate that is used. So it can either be fat, protein, or glucose. Do you know how do we understand this? So what about this tells us that, yeah, we are using fat, yeah, we are using protein or glucose? Can anyone tell me how?
If the result is 0.8, we can say that it's fat, and if the result is 1, we can say it's glucose.
0.8 is fats and 0.1 is...
No, not 0.1. 1 is glucose.
1 is glucose.
Yeah.
1 would be, yes, exactly.
6 CO2, 6.
Exactly. Do you know what okay, so it says already, so RER can be used to measure the energy expenditure. Again, you don't require, let me go to the next slide. So you don't require actually the values right now, but if you were to ever need it, these are the two ways to measure it. One, we already mentioned that the one value we can use RER and VO2 max and VO2. The second way is to measure using the mean energy equivalent of O2. Again, maybe this is something important you should know because they can ask you what is the mean energy equivalent of O2. It is so what it means is that if you were to use 1 liter of oxygen, we would produce 5 kilocalories of energy. This takes into the account that it can be any different, so it can be, that different substrates produce different energy. Yeah, it takes the assumption that all of them produce the same amount, and if we were to use 1 liter of oxygen, we would produce 5 kilocalories of energy. And again, we can use that with VO2 to again find the energy expenditure. You don't require it. If you do, maybe this should cover anything that, if anything is asked, this should cover it. Okay, what is diffusion capacity? Do you guys know what is diffusion capacity and what are the values at rest and at max during exercise?
For oxygen? Or...
Yes, for oxygen. Any idea? Okay, so
25 milliliter per minute.
Yes, exactly. 23, 25, that's exactly right. And what diffusion capacity is the amount of oxygen that can diffuse in 1 minute with 1 millimeter mercury of pressure gradient. And it can, again, if for a person at rest, it's exactly 25 or 23. At exercise, it can go up to 48. And again, for different people, because if a swimmer, for a swimmer, it would be higher, approximately 80. Okay, so we'll move on to the cardiovascular system, and in this we will discuss these values because these values are the most important ones, and these are the ones which we should know by now. So can you tell me what are the normal values for cardiac output, heart rate, and stroke volume? Any idea for cardiac output?
5 liters.
Yes. For heart rate, any normal values? You can give me a range if that's much more convenient.
70 to like 80.
Yeah, yeah, yep. 70 to 80, 70 to 90 would be considered normal at rest. And what about stroke volume? Any idea on the stroke volume?
Stroke volume is the most important.
Yeah.
For this lab.
Roughly
So
about 65 to 70 ml per minute.
Yes, yes. So cardiac output exactly 5 to 6 liters. It can increase up to 5 times more, so up to 30 liters. Again, max heart rate we can measure by using this formula. And yes, the normal one is around 60 to 70 or 60 to 80. Stroke volume in untrained individual, like you said, 50 to 70. It can increase up to 110 to 130. And again, in athletes and people who have a stronger heart and a stronger cardiovascular system, this value would be a little bit higher for both. So for this diagram, do you what is the important thing about this diagram? Can anyone tell me?
What's the question again?
What is the so this diagram?
This diagram is super important. So please understand what Manshur is saying, and someone try to answer, please.
I think it's in the beginning when the heart rate goes up. So like when you start doing exercise, so heart rate goes up, and probably also stroke volume goes up a little bit, but only until a certain point, from which it just can't go up anymore.
Yes, exactly. That's exactly what it is. So at the stroke volume can only increase to a certain point, but to still keep increasing the cardiac output to meet the demands, the heart rate has to can increase further and further. So this is what the diagram. Try to remember this. They might ask you questions on this.
So
any questions?
what's it?
Yeah.
So basically, like the stroke volume becomes constant after some time.
Exactly, because if the heart can only store a certain amount of volume inside the heart, inside the ventricles or the atrium. It can only store a certain volume. So after that volume is reached, the stroke volume cannot increase more, but the heart rate can increase more and then increase the cardiac output further.
Okay.
Right? Okay. The next one is blood flow in muscles. Again, does anyone know? You can say in percentage of cardiac output, how much is the normal and how much can it increase up to during exercise? Any idea?
For example, muscles is like around 1000 ml per minute at rest. Then in exercise, it rises like 12 times more or 13.
Let's say 12, 13. Yes, exactly. 12, 13 times of 1 point. Okay, yes, yeah, exactly. So approximately 20% of the cardiac output, like you said, around one. So in this picture, we can see that during rest, it's around 1,000, 1,500, and during exercise, it can increase approximately to 1,000, 12,000, or 80% of the cardiac output. So how does this blood get shunted in the muscles? Any idea? Okay, well, this answer is quite simple because to have all the blood shunted, you have to vasoconstrict in the kidneys, abdominal organs, and these two are actually maintained. There's less vasoconstriction because you have to maintain the blood pressure. In the others, you vasoconstrict, and in skeletal muscles, you vasodilate, and you are able to shunt almost 80% of the cardiac output to the muscles. Okay.
Can you say about the skin as well, Panshul, about the skin?
Yeah.
Why does it increase in skin? Does anyone know why it increases in skin?
In which skin?
I was just about to ask that because when you exercise, you sort of increase the body heat I don't know how to put it in words.
Yeah,
so
the
because
skin,
of that
okay.
thermoregulation, and you
Exactly.
increase the blood flow. So the skin is really doesn't come
Exactly.
under the shunt, or does it?
You will actually have vasodilation in the skin. We'll come to that, but yes, you're right. I should have mentioned that there's vasodilation in the skin, and that's why there is an increase in the flow. Because there's high metabolism, high heat produced, high temperature, and to maintain the temperature, the blood is used as a mechanism to cool off the body, and that's why there's vasodilation in the skin, and there'll be actually an increase in the blood being shunted to the skin.
And another point for the muscle is that you know that CO2 is acid, right? CO2.
Yes.
So
yes.
the muscle creates CO2 when it's exercising, which is causing local vasodilation. So due to acidosis of the muscle.
Yes, that's actually a very good point to understand how the CO2 affects the vasodilation. Do you guys understand?
Yeah.
Okay, perfect. So the next one is systolic and diastolic pressure. Again, what are the normals values, and then what are the ones during exercise? How much can they increase by? Let's start with systolic. Any idea what are the normal range for systolic?
Blood pressure, guys. Come on, blood pressure. You did it already. You did it already in the first semester.
100 to 130 mmHg.
Yep, exactly. And what about diastolic pressure?
60 to 90.
Yep, 60 to 90. And what does diastolic pressure increase during exercise?
It can, but like it can lower, it can remain the same as well. Like I read it somewhere, I forgot about it.
It most of the time, yes, it can increase a tiny bit, or it can what happens most of the time is either it won't increase at all, or it will drop. Actually, the reason for the drop is because there's so much vasodilation in the blood vessels that it would most of the time ends up being dropping. And what about systolic pressure during exercise? How much can you increase the systolic pressure by, or what value can it increase to? Anything? Any idea?
You mean the systolic pressure
Yes.
during exercise? Like
Yes.
maximum, like
Maximum.
220 maximum.
Yep, exactly. Around 200 for normal people, and if you are an athlete, you can reach up to even 250. Okay, and this, yeah, like I said, this diastolic pressure remains around 60 to 90, and even during exercise, it most of the time ends up actually decreasing and not even increasing at all. Do you guys know what are if the so blood gases values are the values of the pressures in the bloods of oxygen and carbon dioxide? Do you know if these values change dramatically during exercise? And if yes, why? And if not, why?
Not.
It does not, but then why? Any idea?
But doesn't it depend like on the tissue that you're looking at?
Blood gas. Give me an example.
So for the muscles that like are active, they're probably gonna consume majority, if not all, the oxygen. But if it's like if you're looking like I don't know at adipose or whatever, so they're not really.
Let's
Maybe
say
adipose
let's
is
say in the
active.
arteries. Let's say in the arteries.
Sorry?
Let's say in the arteries that let's say the arteries that before they reach the organs. And let's say you have been exercising for a while.
But like if it's before they reach the organs, so like technically it's supposed to be like the like normal situation, no?
No, but suppose you're exercising a lot, and if you're
assuming sorry.
No, go ahead.
No, like assuming that you exercise and the rate and depth of like breathing increases, then maybe there's more oxygen absorbed in the blood.
Exactly. Yeah.
And
So
more
that's what
carbon dioxide removed.
exactly.
But again, like muscles produce carbon dioxide while doing metabolism, so I'm not really sure.
So you actually both the points are right. So what you mean by in muscles, yes, if you measure the values in muscles, yes, there would be actually a drastic difference because there's an active exchange of the two. But if I were to take the arteries, even after having a lot of doing intense exercise, like suppose in a whole 1 hour, 2 hour of exercise, the values in the arteries will still be the same. The reason is there are two reasons. Even when you start, suppose if you were to start exercising and your body goes even before all the adaptation mechanisms kick in, your blood values still do not change because there are two reasons. One of the reasons is because the uh, one second, the respiratory system is actually not so one thing is the respiratory system can aerate the whole blood during exercise. It has the extreme ability to do so. That means it will be able to do the gas exchange very efficiently, so the blood gases over the period do not rise. But also before that, the respiratory system is kicked in before the exercise even starts in, because the if I were to show you, there's an line that's quoted from Guyton. One second, if I can extend this.
Anticipation.
Yes, exactly. Anticipation. Exactly. So because the blood gases do not always because the respiration is stimulated in the exercise before by neurogenic mechanism before the so respiration is stimulated before the exercise even start by the neurogenic mechanism, like Celio said, anticipation. So if you can see in this graph, there's a huge drop in the arterial CO2 just before you start. It's because before the person even started exercising, he anticipated it, and his respiratory system started to increase the respiratory rate, and hence the CO2 blood CO2 dropped. And as soon as he started exercise, it started to increase, and not so much because the respiratory system was able to handle it. And in the end of the exercise, it's approximately same as if same as you had started out with. So that's
can
why.
Can someone explain again what is anticipation? What does it mean neurogenic? Like, why do we increase respiration? Can someone explain it to see if you understood it? Ace, Kirari, Shivani.
Is it
So
like the
assuming, okay, so
is it like the suppose like the person decides to exercise, so that way the neurogenic mechanisms just like understand that they need to start the regulation, so like they're anticipating that, so something.
Yeah.
Basically, neurogenic means just by thinking about it. So there is no chemical change in your body. There is not CO2. There is no oxygen changes. It's not chemical change. It's just in your brain. That's why we say neurogenic, just in your brain, it's your thought. So no chemical changes.
Exactly. You guys understand it?
So what, we just decide that we want to increase the respiration rate, like
No, let's say before you if you exercise every time, and suppose in the gym, and before you even start picking up the weights, or if you start even before you even go to the treadmill, you slowly your body can anticipate it because you're about to go there. It's decided. And there is an emotional what do you say, there's an emotional factor, there is the physical factor, and all of this your body can anticipate, and slowly your respiratory rate will actually be a little bit higher than the normal. Like, the white coat effect, it's again not by any chemical changes, it's just by the psychological effect that you can see the doctor in front of you, and your respiratory system starts to what do you say, become faster. It's psychological. It's like Celio said, it's exactly neurogenic. It's not related to any kind of blood chemical changes, because you would expect that the fact that when you start exercising, the CO2 levels change, and then the respiratory system starts to kick in. But that's not the fact. It's that the fact is that even before there changes to affect respiration, the respiratory system has already adapted to that change. Now do you get it?
Yeah, clear. Thank you.
No problem. No problem. Okay, so
Yes, thank you.
no problem. So how do you so if the blood gases themselves cannot change in their values, how do they affect the not respiration, but how do they how do they affect the exercise, or how do they add to the exercise, somehow improve your adaptation to exercise? If they cannot change in concentration, how do they what mechanism in them is activated during exercise? Any idea?
Sorry, can you repeat the question?
Yeah, of course. So if the blood values in themselves are not able to change so much, that means they're unable to take a lot of oxygen and then support the exercise. How else can they support the exercise?
I think the question is
yes.
I think the question is if we don't change so much the millimeter mercury, the partial pressures, how else can we make the delivery? I think
exactly.
This is the question.
Exactly.
How can you make a delivery that is not dependent on partial pressure change?
Partial pressure.
So is there some other mechanism? Because Panchul said there is two mechanisms. One is this, and the second one is what? We're trying to find the second mechanism of how we can increase delivery of oxygen and gases to tissues and away from tissues without involving the partial pressures and millimeter mercury values. I think that's the question.
Yes, exactly.
Do you want to hear something about this hemoglobin saturation, like right shift, left shift?
Yes, exactly. That's exactly it. Because of the dissociation curve. Now, which side is the shift to during exercise?
In exercise, to the left. No, to the right. Sorry.
Yeah, and do you remember? This cadet mnemonic? It's the factors that are responsible for the right shift. Do you remember the full each factor of this right shift? This each factor for cadet? Anyone? Well, C is the CO2. So if there's an increase in CO2, it would cause the right shift. A is acid, D is DPH, and E is exercise, and T is temperature. So so we know that CO2 is increased, we know during exercise, and we also know about the temperature. All of these factors we know about, and we know that this cadet is responsible for the right shift, and hence during exercise we will have a right shift of the saturation curve.
Can I add something on this?
Yes, of course.
I have a question to you, everyone. Is CO2 considered like a base or like an acid?
Acid?
Yes, it's acid. Okay.
Why is it not both? Like it can be converted. It's the bicarbonate that is both, right? Or what?
Bicarbonate is a base. HCO3.
So we consider CO2.
There's H2 and bicarbonate and CO2, right?
Yes, but we consider CO2 an acid because bicarbonate is a different story. It has to do more with kidneys.
Yes.
And the second important point is, if you remember from the hemoglobin seminar, Professor Edward was really stressed to say that this curve is controlled by the tissues. It's the tissues that they absorb as much oxygen as they require. So this is another important point, because in the arterial system, all the hemoglobin has the same oxygen, but when it goes to the tissue will absorb as much oxygen as they require. This was the most important point in the hemoglobin article. So you need to remember this.
Right. Okay, should I continue, or did you guys understand?
Yes.
Okay, perfect. Let's click on this. Okay, so the last one is the thermal one and the endocrine. changes that happen. Again, what will happen to the change? What will be the changes in the body heat, and what will it lead to? We kind of discussed this already, but yeah. And what are the secretions that are what are the increased secretions for endocrine? Any idea, guys? We discussed the first part already, the changes in body heat and what will it lead to.
So the body temperature increased,
Mm-hmm.
then the body start to remove these heat by like increasing the like blood supply to skin and
Yes,
to remove
yes,
the heat. Yeah, thermoregulation, as Shivani
exactly.
told.
Exactly. So that's called thermal hemostasis. That's all you have to remember. Again, like you said, there's an increase in body heat, which is because of the elevation in metabolism. This leads to the dilation of the skin vessels, hence the more blood supply. And this whole process is called thermal hemostasis. Just remember the word if they ask you. And the increase in secretions are of these two, catecholamines and cortisol. Again, the fight and flight response to the exercise. The last one. What is O2 debt? Yeah.
But can I just
Yeah.
ask some? By the way, they also, like, I read that in the pituitary gland, due to exercise, it increases the human growth hormone secretion.
Yes, that's actually right. It's exercise, and I think the breakdown of muscles, all of this, because there's breakdown of muscles, you would want what do you say, growth hormone to be released. So I think there's the mechanism, exercise plus damage to cells, because when you exercise there is waste products produced and there is damage to muscles, and all of this requires regeneration, and that's why there's the production of growth hormone. But again, I'm not too sure on it. If you are more sure on it, you can add to it.
I just wanted to ask, since like it didn't make sense to me immediately, but the decretion of the muscles makes sense now. Thanks.
Yeah, I think so. I'm not 100% on this, but yeah, you're right. There's an increase in growth hormone as well. It's good. Do you guys know what is O2 debt and epoch?
Amount of oxygen required to oxidize the lactic acids.
Exactly. O2 debt. And what is epoch? Any idea? This is the full form.
Does anyone know the name? What does epoch mean? Just the name, not to explain it.
Yeah.
The excess post-exercise oxygen consumption.
Exactly. So for this concept, you have to understand this graph. This graph is pretty much sums up everything. Can anyone explain it? I will explain it anyway. But if you guys want to try explaining it, you can try it now. Do you guys want to try?
I think you can explain it.
Okay. Okay. So to understand this, let's start with the first part where we start over here. This is when we are at rest, and the amount of oxygen being consumed at rest is around 3.5 ml of oxygen per kg of body weight. Let's take this as a resting O2 consumption. Yeah. Now let's say we are at resting and we jump on a treadmill. As soon as we jump on a treadmill, our O2 demand reaches this high, right? We were at this when we were resting, we were sitting down, and we jump on a treadmill and O2 demands reaches this, right? Now when the O2 demand is this high, our body cannot just directly jump to that demand. It has to slowly adapt to it, right? It increases the respiratory rate, which is already increased respiratory rate, the vasodilation, like is all of these adaptations slowly come in, and slowly over a period of time the oxygen over time the oxygen demand, oxygen consumption or the oxygen supply reaches the oxygen demand. But after we reach over here, we have to realize that because it did not reach directly there, at some point, suppose at this point or this point, the oxygen consumption was lower than the oxygen demand. because at this point the oxygen demand was lower, oxygen consumption was lower than the demand. That means that all of this was anaerobic respiration. Because the body doesn't have enough oxygen to supply, it cannot consume so much, and if it cannot consume so much, it cannot meet the supply, demand. It cannot meet the demand. That means the rest of the demand is met by anaerobic respiration. Now, what happens with anaerobic respiration is we produced lactic acid. So over this period of time, we were building lactic acid. Do you guys understand this part?
Yep.
Okay, perfect. So now let's say we have built up some amount of lactic acid, but we have reached a steady state. A steady state of oxygen consumption is that when there is equal amount of consumption, equal amount of supply and demand. That means there is no there is the supply and the demands are met, and there is no form of no lactic acid being produced. Now we reach this point. At this point, let's say we jump off the treadmill, and our demand drops to 0, right? So this was now our demand is over here. Now, theoretically, if our oxygen consumption should also drop because the demand is low. But because we have so much lactic acid built up from here that we need to get rid of, that what we do instead of just dropping the oxygen consumption is that we still use the oxygen in this slowly. We still use oxygen to remove the lactic acid, and this oxygen consumed to remove the lactic acid is called EPOC, which is the excess post-exercise oxygen consumption. Do you guys understand the graph now? If you have any doubts, just ask now, because this is kind of an important diagram to understand.
Panshul, you should choose someone to explain it.
Okay. Who maybe anyone wants to? Does anyone want to explain?
Someone explain it, basically.
Can I ask a question?
Yeah, of course, yes.
You know, there's like a certain, let's say, gap of time between the lactic acid starts production and between it builds up and then you feel pain. So
yes.
Do you have like any information like about that in case
time?
Like how much time or concentration or something like that?
I do not know.
It depends on the person, because if someone is trained for marathon, they will have so much bigger tolerance.
Yeah, but let's say it's not an athlete. Let's say it's a person who does normal amount of exercise, like let's say 2-3 times a week. I don't know, 4, like not athlete.
I think the answer is a little bit complex. I remember Professor Vlad answering this question once. So I think what he said was it depends upon so let's say if the person does not do exercise and he suddenly starts to exercise, that means the body goes under shock. And if the body goes under shock, there is anaerobic respiration, and if there's anaerobic respiration, the buildup is faster. But if the body is more let's say you was jogging first and then you start to run, so your body has slowly adapted to it, and then if you start to run, the lactic acid buildup would be a little bit slower. But again, I think you should ask a professor on this one. I am not too sure. Does it make any sense?
Yeah, it does. I bet he would probably say something similar, so thank you.
Yeah, no problem. Any other questions?
Can you explain why oxygen deficit is like quite lower than the epochs?
The oxygen deficit is lower than the epoch.
It's not why it's not equal. At first, I thought that this left part is like glycolysis and right part is glycogenesis.
Right.
But why it's not equal?
I don't know. I thought. Wait 1 second. Let's see. The deficit happens because the lactic acid is being produced, and the epoch is just the breakdown. Maybe it's because the
why I'm breaking down more than I create.
No, because
I think the answer is because you have to create your stores as well. In epoch, you use oxygen to replace the stores, not just the deficit, but also go back to your normal stores. So the epoch includes the oxygen deficit, which you need to pay for the lactic acids, and then you need the oxygen to replenish all the stores. There is a slide in 2 slides explaining it.
Thank you.
Okay.
Wait, could you just repeat it? Because of the connection, I couldn't hear anything. It's all cut off. Sorry. Like what Stelios said, could you repeat it, please?
Okay, Stelios.
There is a slide in 2 slides. You will see the table between the difference between oxygen depth and epoch, and it explains there why we have higher epoch. It has to do with replenishing the stores, phosphocreatine and all the other stores. That's why we use oxygen not only for the O2 deficit, we use oxygen also for the stores that were depleted.
Okay, yes. And I also had a question before about like we have phosphocreatine, then we have anaerobic respiration, and we have oxygen consuming respiration, so aerobic. But when do we use what and how? Like
Yeah, this is a good question.
We'll talk about it after.
Yeah, we will talk about it. Yeah, Stelios will talk about it.
Okay. Okay. Yeah, thanks.
Okay.
With the help of Panchul.
No, you got it, man. No problem.
With the help of.
So I've summarized the explanation over here if you guys ever want to read it, and there's more information about the deficit and epoch. Again,
so
you can read
you
this
see
on
on
your
the
own
right
time.
there is possible factors causing epoch. That's all the thing why it's bigger. You see removal of lactate, replenished glycogen, myoglobin, hemoglobin.
Do you guys see it? So again, this you can read on your own, and exactly this I think will cover out any doubts that any points that I missed. And again, I've summarized all of the important values and how much they increase by if you quickly have to have a review. And that's from me, and now Stelios will continue. Do you have any doubts? Okay, again, no. Stelios, you can continue then.
Don't go anywhere, I'll need to help. Huh?
Okay, yes.
So close your screen, I'll put mine.
Okay, let's do that.
Can everyone see my screen or? Okay, yes. You can see my mouse as well?
Yeah.
So the pen is P, okay. W170 test, what is it? Can someone tell me? What is this test?
Checks the heart rate till 170.
Wait, say again. What does the 170 mean? I think you said it. What is 170?
To achieve 170 pulse rate.
Okay. And what is a W? W for?
Exercise, strength, intensity.
Okay. You know what is the unit of power?
Watt. No, watt.
Yes. Shit, my handwriting is not that good. Okay, that's watt. Okay, 170 though is the heart rate. So W170 does not mean 170 watts. It means it's the watt test, how much watt we produce when we have 170 heart rate. Okay, so W170 means how many watts in 170 BPM. So basically, it's a test we use to investigate the relationship between the intensity of exercise, which is measured in watts, and the heart rate. So the heart rate, we chose 170. However, if someone is elderly, we're going to use a lower number, okay, for the heart rate. Why 170? Because of the anaerobic threshold, okay? So basically, 170 BPM is the heart rate at which a healthy young man reaches his anaerobic threshold, okay? Important thing that Panchul mentioned before is the stroke volume, yes? So the cardiac output only depends on heart rate because the stroke volume remains unchanged. You remember the graph that I told you, it's really important. After a point in exercise, the stroke volume does not change, but the heart rate changes, okay? So everything depends on the heart rate after a specific point. So we have this anaerobic threshold, and before the anaerobic threshold, there is a linear relationship, okay? Let me just erase everything. So these 3 points, everyone is okay with these 3 points? That we have anaerobic threshold, we have a linear relationship, and we have a constant stroke volume, and everything depends on heart rate. Everyone okay with this? Or you're confused?
What do you mean by the linear relationship?
So basically, I will explain what I mean. In the beginning of exercise, you have a linear relationship, and then it starts to go up. So this point here is the 170 BPM, okay, in a healthy young man. So we don't care of all the bigger values. We just care of this graph here, this line. So if you see it translate here, it will be something like this, you know? So we only care about this part of the graph, which is linear. So that's what does mean linear. And then we have the heart rate. That's why we use the heart rate in the test, because it's the only thing that affects exercise after a point, because stroke volume is the same. So these two things, you understand these two things? That is linear, and there is the heart rate. It's what makes the cardiac output, not the stroke volume. These two things are okay?
Yeah, I got it. But like,
okay,
why is it linear and not exponential?
I will explain now.
Okay.
It has to do with this. It has to do with the point that there is an anaerobic threshold at 170 BPM. So can someone explain what is anaerobic threshold?
At that point,
yes, Ace?
At that point, lactic acid accumulation will start? Like after
yes,
that point.
But the thing is, if you look at the word, it says anaerobic threshold. So basically, it's the moment where you stop to use oxygen. So we have some terms. We have 3 terms. I want to explain 3 terms. And what you just said is called lactate threshold. Okay? So there is a term called lactate threshold. Lactate threshold basically means the lactate begins to accumulate within the blood. So the production of lactate is bigger than the lactate excretion. If you look at this graph here, you have some lactate going up, okay? And I want you to see this blood lactate, okay? So we take it by blood sampling. We don't use lactate threshold because it's invasive. So instead of using lactate threshold, we're going to use anaerobic threshold, okay? Which is based on gases coming out from your mouth. So what Ace just explained is the lactate threshold. It has to do with lactate accumulation because the production is bigger than the excretion, okay? Everyone okay with this term, lactate threshold? So you have lactate going in a linear fashion, going up, and then at the point, it starts to go in a non-linear fashion. This is a guy who is not trained, and this is a guy who is trained. So both of them, they have a point. Of course, it's different. It's different for each one. If you train, you can make it bigger, this threshold. But it has to do with lactate, only lactate, and it has to do with blood sampling, okay? The lactate threshold. Is everyone okay with this term?
Yeah.
Okay. Another thing about this lactate threshold is that it is affected by the bicarbonate because it's blood, it's in the blood. There is some interaction with the bicarbonate. So here it will not be as accurate, let's say, because it's affected by the bicarbonate and stuff. And then you see that the line goes, the red line goes at the linear fashion. And then at this ANP, which is the lactate threshold, it starts to become non-linear. Yes, you see that it's non-linear. So this is where we have acidosis. You know, acidosis means your blood starts to become more acidic. And it's because lactate, it's lactic acid, it's acid, yes? Everyone okay at this point? Or are you people confused?
Yeah.
Anyone has a question? I want to hear one more. Yeah, please. Everyone okay with this? Or shall I explain again?
I'm okay, but I guess you needed another yes.
Where is Ace?
Yes.
Samia. Okay, good. So basically, this part of the slide is about the lactate threshold. Okay. Now the lactate threshold is going to make at this point we said acidosis, right? So we have acid. So this will affect our ventilatory threshold. Okay. Ventilation is how we breathe. So what is the ventilatory threshold? It's a ventilation starts to increase at a faster rate than VO2. What does it mean VO2? It's basically how much oxygen you use. So this is VO2 basically means aerobic respiration. Okay? So we have aerobic respiration. Ventilatory threshold means that you ventilate with your lungs at a higher rate than what is required for your aerobic needs. And why is this? This is because of, it's the same graph you see at the same point. Here you have the acidosis. So it's because of the acidosis that you start to ventilate higher than your oxygen needs. This is called ventilatory threshold. Ventilatory threshold is an effect of the lactate threshold. Ventilatory threshold is because of the acidosis at this point. Okay, so you ventilate not just for your oxygen needs, but you also ventilate for your acid needs. So for the acid base, I don't know if you read the chapter, you have two organs, the kidney and the lungs. So this is where the lungs kick in to balance the acid-base balance, okay? So ventilatory threshold has to do with ventilation, which is basically the air going in and out of your lungs, to give the oxygen for your VO2, which means aerobic respiration, as well as the acid produced from the lactate. So that's why you see, this is just, you see the line here? It's linear because we are just increasing ventilation to provide oxygen for our VO2. VO2 means aerobic respiration. And then at this point, we have so much lactic acid that is going to start going up because we are ventilating for our oxygen demands as well as our acid demands, okay? So the graph is here explained better. It's a linear relationship in the beginning at lower levels of work because we need the oxygen. And then at about 200 watts, there is increase in ventilation, more than expected, yes, because we have the lactate threshold, the anaerobic threshold, okay? There is lactic acid, and this lactic acid affects the peripheral chemoreceptors. So peripheral chemoreceptors are responsible for your acid base as well, okay? So at this point, we not only breathe for our oxygen needs, we also breathe for our acid needs. That's why it's non-linear fashion. Okay? Yes? Are you lost?
Yep.
So you're lost. Okay.
I mean it's good.
Yeah, understood.
So basically, ventilation. What is ventilation? If we say ventilation, here, ventilation, what would it mean, ventilation? Ventilation? Someone? Definition of ventilation? Just a simple question. No one can explain ventilation.
It's the movement of air through the respiratory system from the atmosphere to the lungs.
Yes. And why do we need ventilation? One thing is our oxygen demands, right? So this part of the graph shows that during exercise, we need more oxygen. It makes sense. We need more.
And also for excretion.
Excretion of what?
Of carbon dioxide.
And carbon dioxide is what? An acid or a base?
An acid.
Yes.
So for acid-base regulation, if that's what you're looking for.
Yes. For acid-base regulation, we have all this part of the graph here, this part of the graph, which is increased. This area of the graph is for our acid, and this area here of the graph is for our oxygen needs. So we were expecting that it will continue in this fashion. We were expecting that it will continue linear fashion because we have more oxygen demands. However, at this point, everything goes, it's extrapolated. It's increased very much in a non-linear fashion. And we're asking ourselves why at this point we start to ventilate much more than expected. And the answer is because we have a lot of acid. We reach our lactate threshold. If you go back lactate threshold, we said it's an acid, right? At this point, we have so much acid. So because of the lactate accumulation, because of this acidosis in our blood becomes acidic, we have to ventilate higher, a lot higher, because we're not just giving oxygen, we're also excreting the carbon dioxide, which is our acid, okay? So basically these two terms, the lactate threshold it means what Ace said before. There is a lactate accumulation because of the production is more than the excretion. And it happens at this point over here. Yes. Which also correlates with the ventilatory. This is the ventilatory graph. With the ventilatory graph. So if we see that both the graphs are correlated, at this point, we have increase in ventilation and increases acid, we say, okay, this causes this. There is a correlation and causation. The acid causes the ventilation to increase. Okay, you understand how ventilation is affected by acid as well? Not just by oxygen demand. Oxygen demand is our VO2, okay? VO2 means oxygen demand. It's our aerobic respiration. So ventilation, it does two things from this point onwards. From our anaerobic threshold, from our lactic threshold, it starts to do two jobs. We increase it so much. One is for the acid base and the other one is for our oxygen demands, okay? I just want you to understand these 2 points. Our ventilatory threshold is for breathing, the ventilating. Lactate threshold is for our acid in the blood. That's why we need blood sampling from it, okay? Everyone okay with this?
Yes.
Any questions before I continue?
No.
Okay, so then we go to the other term, which is, okay, question. Where do we find the peripheral chemoreceptors that they are going to measure? Carotid, and where else?
Aortic arch?
Yes, yes. So we have the blood pH. This one is a part of the carotid and aortic arch, okay? So blood pH is also important as well as the oxygen, okay? We have also the CO2 in the brain, in the CNS, which is correlated with the blood pH, as we said. It's a kind of acid, okay? So the central chemoreceptor, when it measures the CO2, it's actually indirectly measuring the pH as well, okay? So in the carotid and aortic arch, you can read this here, we measure the pH and as well, okay? So this acidosis will cause the breathing, okay? That's why we have the ventilation, the ventilatory threshold. So not only we have the O2, in the beginning it was linear fashion because of O2, but after we have also the lactic acid making the pH. So both of these, they're gonna make the graph of breathing really high, okay? Everyone okay that we have peripheral chemoreceptors detecting the pH, the acid, making our ventilation higher, not just the O2?
Yeah.
Okay, so now we talk about the lactate threshold, the ventilatory threshold, and now it's the anaerobic threshold, okay? VO2, what is VO2? I told you before, what is VO2?
Demand of oxygen.
Yes, it's the oxygen consumption, okay? This is our aerobic respiration. VO2 max means how much oxygen consumption can you do, okay? So it doesn't have to do with if the lactate starts to accumulate, if I don't know, any other factors. It has to do only with how much your body can how much energy your body can create only using oxygen. Okay, it's the maximum rate of energy created by oxygen consumption. Okay, everyone okay with this?
Yeah.
So rate, what is the unit of rate? What is the unit of rate, maximum rate?
ml per minute or liters per minute.
Yes, yes, okay. So we have this unit here, liters per minute, okay? But because this is the absolute rate, okay? How much actual oxygen are you using per minute? But because every person is different and there is some variation, we can use a relative rate. Relative just puts here the kilogram of the person, okay? So that's why when someone comes inside, you need to know their gender, their age, all these factors, as well as their mass. And then we can use per kilogram of the patient, per kilogram of our subject. So we can make it relative. So in our experiment, when our subject comes in this case, one of you, one of the students, we're going to make our measurements based on per kilogram. So if someone is more has more weight, we'll have to do more work. or someone has less weight will have to do less work. So basically, you have to remember that we will adjust by per kilogram, okay? I will explain the laboratory afterwards, but remember that it's per kilogram. We're going to use the value per kilogram. The SV max here, we know it. It doesn't change. It's constant because after a point, we know that it becomes constant, as Pansh will explain. The oxygen difference we can measure. The heart rate we can measure. And then we can calculate the VO2 max. Okay? So this is our equation. And we can find that the oxygen, as you can see in the graph, increases, and then reaches a point where it becomes straight. Here, you cannot do any more aerobic respiration. This is the maximum point for a person. However, this can be trained, this can change, okay? But this is the maximum this is the maximum energy your body can create by using oxygen, okay? That's our VO2 max. VO2, aerobic respiration by using oxygen, max, the maximum of it. Everyone okay with this, or are you confused? Did people leave?
Guys, respond to him.
It's okay.
Everyone is here. Okay, so basically that's it. We have three terms now. We have discussed the lactate threshold, the ventilatory threshold, and the VO2 max. Okay, these three terms. So I'm gonna do a small exercise to see if you understood it. I'm going to ask who has the bigger VO2 max from these two people. Okay, so someone comes in with 6 liters of lung capacity, and another one has 8 liters of lung capacity. Who has the bigger VO2 max? Can someone answer?
8 liters.
Okay, so this is a trick question. The lung capacity has nothing to do with the VO2 max, okay? Because someone can have a lot of lung capacity. There is a lot of ventilation. However, maybe he doesn't have enough mitochondria. He's not enough trained. Yeah, he's not enough trained. There is a lot of parameters that go inside. So with lung capacity, you cannot predict who has the highest VO2 max, okay? So for the next question, a guy comes in with 10 liters of maximum in ventilation and 12 liters maximum in ventilation. Who will have the highest VO2 max?
liters.
Again, the maximum in ventilation is just ventilation. It has nothing to do with the VO2 max because someone could be more trained or less trained. So basically, you cannot predict from these values who has a higher VO2 max. Okay? Do you get it or are you confused up to this point? Because these two values have to do with the ventilation, okay? If you see our equation here, there is no ventilation involved. Yes? There is the heart rate, the stroke volume, which is constant at this point, and the difference in arterial gases, which is basically dependent on hemoglobin and all these things. So ventilation is not a factor of your anaerobic threshold, okay? Your maximum rate of oxygen consumption cannot be estimated by the respiration and ventilation, by the ventilation and breathing, okay? So these two values make no sense in VO2 max. VO2 max is how much oxygen consumption we can make, yes? Everyone okay with this?
Yes.
Okay, now the third question. You have two patients with the same age. One has a healthy heart and the other one has a damaged heart. Who will have a higher VO2 max? So the second one is very simple.
The person with the healthy heart.
Yes, because if you see here, the heart rate and the stroke volume actually play a role in the VO2 max, yes? The heart rate plays a role. So yeah, it could be the healthy one. We can estimate it to be higher. That's for example, can be someone who is training, someone who is basically even better than someone who is damaged, okay? So the heart rate actually plays a role in our equation. And the last one, if we have a young one with a lot of mitochondria in his body and an old guy who has no mitochondria, who will have the higher oxygen consumption, VO2 max?
The 24-year-old.
Because of what?
One, because of age itself, and then
Yes.
also because of the mitochondria, but
yes. So
I'm
how
not
can you increase
too sure
mitochondria?
about the mitochondria.
Because it's an aerobic respiration, no? Mitochondria are needed for aerobic respiration. So how can we increase VO2 max? By exercising, when you exercise, you actually create more stores, you create more muscle that has a lot of mitochondria inside. Yes? So basically, don't confuse, my point from this slide is don't confuse the VO2 max, which is oxygen consumption, with ventilation. Okay, this part of the graph is what I'm trying to put in your brains. It doesn't have to do with ventilation. It has to do with oxygen consumption, okay? I want to put this in your brain so you don't get confused.
Yeah, what did you say again for how can we increase VO2 max? Again, connection, I couldn't hear properly, sorry.
It takes exercise. So with exercise, you increase your stores, that is hemoglobin, phosphocreatine, all these things, plus the mitochondria. There is two types of muscles, fast twitch, slow twitch. And when you exercise, you have, Panshu?
Yeah.
When you exercise, you use more, you increase your VO2 max, right? By creating muscle that is more oxygen dependent.
Like you said, the more the mitochondria, the better the heart, the better the VO2 max. Yeah. So both of them are improved in exercise. So with exercise, you should be able to easily improve VO2 max, right?
Yes. So basically, with exercise, you don't make your lungs bigger. You make your oxygen consumption VO2 max bigger by other means.
You can improve your heart becomes stronger, and you'll have a lot more mitochondria. I mean, the more the cell, because in what do you say, during exercise you build new muscle cells also, right? So well, the more muscle cells you have, the more mitochondria you also have. So the mitochondria point checks out, and then when you exercise, your heart also improves, your cardiac, everything about the heart, the strength, the contractility, all of this also improves. So again, both of them are responsible for the VO2 max to increase.
Everyone okay with this?
Yeah, I got it. Yes, thank you.
Okay.
Katie is okay as well, because Katie disappeared. Where is Katie? Katie?
No, I didn't disappear. I'm listening.
Okay. It's okay?
Stelios, if I had question, I would ask. Don't worry.
Okay, yes, okay. So the laboratory, finally to the laboratory. We have this table we need to fill, right? So we have a table. So some people in you will be taking measurements. And then this is the procedure of the experiment, okay? Remember when I told you that we have per kilogram? So we're gonna use per kilogram for this experiment, okay? So we need the weight of the subject. And what are we going to do is basically, we're gonna put our subject to exercise, okay? Before we do, we take the resting values. We go here to the 0 minutes, yes, resting values. And we're gonna measure all these things: heart rate, blood pressure, PO2, value of metabolism, minute ventilation, respiratory rate, resting heart rate, time to reach heart rate 130 per minute. This will happen during the exercise. Systolic pressure, diastolic pressure, temperature, yes, temperature, all these things. And how we're going to do it is basically we measure the resting values, then we make him work a bit, we make him exercise for 4 minutes, and then at 5 minutes, we're going to measure his vitals again. Then we're going to increase the load. He's going to work even harder. 1 watt became 1.5 watts. He's going to exercise harder now. And then after, at 10 minutes, we're going to take his measurements again. And then a third time, so only 3 times, he's going to work really fast, even harder now. So difficult exercise. And then at 15 minutes, we're going to take his vitals again. So this is the motion. This part of the measurements is when the subject, our student, is actually making the exercise. And then this part of the experiment is actually the epoch. Remember the epoch? So there is the recovery period, and in every 2-minute intervals, we're going to take his vitals to see how he recovers. Okay, this is the recovery. So basically the experiment is we measure at rest, then he works for 3 different loads, and then we take the resting measurements, the recovery measurements. That's a simple experiment, okay? And from this table, we need to find these 7 things. We need to calculate these 7 things. That's basically the experiment. The value of metabolism, the performance. Performance is what unit? Performance, which unit are we going to use? Remember W170? So it says at heart rate 170, that's 170. And then the performance is what unit? What's the unit of performance?
Watt.
Yes, watt. So that's why we need this experiment. If you look at number 7, time it needs to reach our target heart rate, 130 beats. And you're going to be like, wait a minute. If our target heart rate is 130 beats per minute, then how can we find the 170? If we do not allow our subject to reach 170, how can we find the performance at 170? Because our target actually will be 130 beats per minute, okay? And subsequent recovery time. And this I will talk about later, okay? This has to do with the linear graph. Another measurement, heart rate and ECG, systolic, diastolic pressure, skin temperature. This is straightforward. From 3 until 6 is straightforward. So the things that are a bit difficult is number 1, 2, and 7. So the metabolism, value of metabolism, the performance, and the time it needs to reach our target. Okay, number 7 is easy as well to measure, but we're going to use it to find number 2. So these 7 things we have to find by using this graph, which is based on this procedure. Okay, it's easy experiment. So 2, 3, and 4, and 7. Performance at the heart rate 170, the ECG, the heart rate, and okay. So for 2, 3, and 4, performance, heart rate, ECG, we're going to use some instruments. Okay. So which 3 instruments do we need for these measurements? I want 3 instruments that will help me to find the answers to 2, 3, and 4. So what instruments do you know for these things? Can someone try to guess? Can you start with the easy one? ECG, how can we measure ECG? Straightforward. No one knows how to measure ECG. Second year physiology student.
Come on, guys.
Second year physiology student. How do we measure ECG?
Say something.
Electrodes, I don't know, Holter.
Yeah, ECG machine.
Exactly,
yeah.
ECG machine. Yeah.
ECG machine. Okay, now that we talk about ECG machine, does anyone heard about the Holter monitor? You know what's a Holter monitor? Holter?
Yes.
Okay, so, okay, I'll show a picture of it afterwards. Heart rate. How can we measure heart rate? There is 2 ways. The one we just said, the ECG machine, of course, and there is another one which is easier.
Pulse meter?
What? Ace again? Ace? Say again.
I think she said pulse meter, pulse.
Yeah, pulse oximeter. Yes,
oximeter,
pulse
yeah.
oximeter. Good. So we have the pulse oximeter, and if you can see, there is a saturation. But remember, pulse oximeter is not just saturation. You also have the heart rate here. Okay. So actually, this machine can do 2 things: saturation and heart rate. So Ace was really correct on this one. We have our ECG machine, which we will use in our experiment. I want to mention the Holter monitor. Holter monitor, basically, it's a portable ECG. You put it on the patient and he can have it for 24 hours or whatever, and it has a memory inside, so you can store it. Some scientific sports centers, when they do these VO2 measurements, the VO2 max, They can actually use a kind of a Holter monitor with Bluetooth that can send the information to the computer, but it's pretty expensive. That's why we go for the traditional ECG. Okay. The thing with our student is that he's going to be exercising. You know, he's going to be on this thing, and he's going to be exercised. So basically, we put it on the student, then we remove it, and then we put it again, and we remove it. So we will repeat this process because it's cheaper, and we get the data anyway. So this is what these two things are going to use. We have the heart rate from the first one. It's going to be always on our student. We have the ECG machine, which we're going to put on the student, remove it every time he's going to exercise. And then for the performance, we're going to use this machine. Do you know what's the name of this machine and how does it work? Because it's really important. This is the first time you're going to see this machine.
Ergometer, something, I don't know.
Yes, exactly. Oh my God, I thought it was going to be more difficult. It's called an ergometer. And how does it work?
So basically you can choose a load and then you just cycle with that load, which basically means your upper body is stable and you only work your lower body.
What is the unit of the load? If I go to program, so I'll go to the next slide. You said ergometer.
Watt, no?
Yes, in what? So you said ergometer. What does ergo mean? It means work. Okay, so it's going to measure the work. It's a meter for the work. So how much work are you doing, the performance? How does it work? You said that we have to program it. Yes, we use watts. Okay, we put watts. So this is very important questions. These two questions over here are very important. So we go to this ergometer, we put some watts. Yes, it's based on the load here. 1 watt per kilogram. So if someone comes and he is 70 kilo, it's going to be 70 watt. Yes. If someone is 100 kilo, it's going to be 100 watts. So that's our programming. We put the watts in the programming. Then we're going to increase it. 1.5 watt per kilogram, 2 watts per kilogram. Everyone okay with the programming? How we program it? So it has to do with watts. It's a machine that you don't find in the gym. You put the watts inside. It's an ergometer, not a cycle. It's not the same as the gym. It's different than the gym a bit, okay? Everyone okay with this?
Yep.
Okay, and now I want someone to answer these two questions. Who wants to answer these questions? Katie, you want to answer these two questions? Or Samia, or someone? Kirari? Or no one has a clue? Does anyone have a clue? Does someone want to answer this? Or shall I just explain it?
Wait, when you cycle faster, the load remains the same or what?
Yes, the load remains the same because it's programmed.
So basically the work done would be the same.
The same, yes. But if you cycle, explain it. Yeah, go on. I'm listening. Go on, Shiva.
So the work done would be the same, but what was the unit for the power again? Wait, does it have time?
No.
So if that's the case,
it has the energy.
Then the work done will be the.
It has the energy. Okay. How much energy you're putting? You increase the energy, right? Okay. So the watts equals the energy you put, yes, per time. Yes, per time, of course. That's the watt. It's like joules per minute. That's the watt. However, the energy, it will go into two things. Yes, how fast you go. I'll say here velocity, how fast you go, versus what is the resistance from the machine. Okay. How fast you go and what is the resistance of the machine. This is actually the energy you're putting in. So if you go faster, if we want to keep this the same, we have to keep this the same. So if we go faster, what happens to the resistance of the machine?
It will increase in order to ensure that
it will decrease. It will decrease. So to keep this the same,
but I thought the machine maintains the resistance.
No. Yes, the machine calculates the resistance to maintain the load. Okay, that's the difference. So if someone goes really fast, it will be too easy. You know, it will be too easy because he's putting the energy to make it go fast. So he shouldn't also be putting energy against I don't know, going up the hill or down the hill. It shouldn't go any resistance, okay? So that's why it's an ergometer, because it has to do the same watts, okay? So if you go faster, it should be easier. If you go slower, it should be harder for you. So at any point, the student should be giving out the same energy. So if I sit myself on this ergometer and I say, you know what, I'm not gonna move my feet. I'm gonna do 5 cycles of my feet every second. I want to go chilled. The machine, to make me work as hard as someone who is on the machine going really fast, doing 100 cycles per second, is going to give me a resistance. It's gonna be, look, Stelios, you want to go slow? Okay, go slow, but you're gonna have to work against the resistance in order to give out the same energy. And someone who is going really fast, the machine is going to be like, whoa, you're putting too much energy to make yourself go faster, so I'm not gonna put resistance on you. Okay, you understand how it works? Because our point here is the same watts. So this is an important concept for this machine. So this machine is not the same as your gym. Maybe it's the same, I don't know. If you go faster, it becomes easier. It's the same as the gym? Yes. It's been so long to go to the gym. Yeah, so this is the ergometer, okay? The faster you go, the easier it becomes. The slower you go, the harder it becomes to move your feet. Okay? I don't know if in the gym you just put the resistance, you control the resistance, but this one has a computer inside. It controls the watts. Okay, that's the ergometer. Everyone okay about the ergometer, or shall I explain it one more time?
It's good.
Okay.
Okay, so ergometer, ergo is the performance, it means work. The performance is in watts. We program it by watts, not by resistance. We don't say I want it to be level 6 hard or level 5 hard. We say this many watts. No matter how fast I go, I always want to give out these watts. Okay? That's the ergometer. So it means work, it's watt. It will be easier, less resistance, will be harder, more resistance. That's the answers for it. Okay, so this is the graph I was explaining before. We said that the W170 test from before, this is a slide from before, it's going to be linear before 170. So if we go to the heart rate, this is the heart rate, from 170, this will no longer be linear. It will go something like this, okay? So this part of the graph will be linear, but this one will not be linear. So in order to find our 170, we're going to extrapolate. Our target is 130, should be something like here. We take 3 measurements, okay? This is the watts. This is the graph of the watts. We put our per kilogram, right? So we have 1, 2, 3, whatever measurements. We take our measurements, we make the points. It should be a straight line. We find our 130 BPM. We put our points, whatever. And then we use extrapolation, okay? This line is basically not measured, it's extrapolated. It means based on these points, we just put the ruler like this and we make a line. You did this in biochemistry a lot, I suppose. Everyone knows what is extrapolation? Yes? Extrapolation. Basically, we don't measure this graph, we just deduct it from the previous points. Yes?
I have a question.
Yes?
Why is the target 130 beats per minute?
Because,
I didn't understand
that. Why? Anshul, you know why?
I think because at one, you mean why can't it be 80 or something? Or why do you, what's the question exactly? You mean why can't we go?
I mean the test is for 170 beats per minute.
Right.
So why are we putting the target as 130?
The reason we don't go to 170 is because that is too hard. It's too hard to. It's not necessary to push a person till 170 just to figure this out. If we can just use 130 and like Salio said, just extrapolate, we can just the values will approximately be the same. And pushing a person to 170 may cause some issues because it's not the same. 170 is quite a lot of intense workout. So if someone may not be able to handle it, it could cause some issues.
Okay.
Yeah.
Yeah.
And usually people stop way before that due to discomfort.
Exactly. 130
they can actually go there, but they say, I'm sorry, doctor, I cannot go anymore. Actually, they can go, but they give up because they have different willpower. You know, some people they just don't want to do it.
It's too uncomfortable. Yeah, that's the word. It's too uncomfortable to push someone to 170. 130 is reasonable, and at the same time, it can do the job.
Okay.
Okay. So we're using the same machine, the ECG machine, the pulse oximeter, and we get these values, the heart rate, the performance we know from the ergometer. So the only thing we need to do is go in the ECG paper and measure these ranges, QT, QRS, PQ, and HR, heart rate. And we're going to plot just the numbers, okay? Just the duration. For example, PQ interval, it was these milliseconds, these milliseconds, these milliseconds, okay? So we don't need actually the curve. We don't need to draw the curve or something. We just say the interval. It was these milliseconds, these milliseconds, these milliseconds, and we can see how it grows, yes? And then you make a graph. You say, oh, okay, it grows like this, it grows like this. So you have the growth because they're going to be increasing or decreasing, okay? Depending on which one. So with using these instruments, we calculated these 4 things over here, okay? So that's this part of the experiment. There is some equation here, like the Bunger formula, whatever. We don't need to know this. I'm just saying that when you do this test, you can actually use the watts and heart rate and all these things. We don't need to know for this experiment. For this experiment, you don't need to know W170, but it is actually based on the theory of W170, okay? So you need to know a bit of the theory. You need to know this thing, which is the theory. You need to know the theory of this test, not how to perform it, not the formulas, nothing, just the theory. You need to know what is an aerobic threshold, why it's linear, why the stroke volume does not change. Basically what Panchul explained before, okay? These things you need to know for your theory and explain it for your exam, but you don't need to perform this experiment. And the only thing that we involve this experiment, W170, is just the performance at the heart rate of 170 beats. That's the only thing. We don't need to make a VO2 max from this experiment. We don't need to do anything else. Just extrapolate the line and find 170 and say, okay, it's this many watts, done. That's the only thing, okay? I just went into details to explain this test because if you understand this test, you can actually answer most of the things for this lab. Not the theory of exercise, but the lab. If they ask you for the lab, why do we do anaerobic threshold? Why is it linear? Why no stroke volume? So if you understand this experiment, you can actually answer all the questions they will ask you. Okay? Everyone okay? Why I explained this experiment? So I'm done with this experiment, okay? Yes? Okay, everyone?
Does anyone have any doubts or anything, any questions? Because he's going to move on from the experiment now.
I'm going to move on to the experiment, okay? What's the next one?
Yeah, you can move on.
Okay, next one. So we said we have to fill in this table. And this thing over here, it says value of metabolism, kilojoules per minute. How do we get this value? Can someone explain? You should already know.
Indirect calorimetry or something?
Yes, you're right. You're right. And my God, you jumped very fast. Okay. Why is oxygen consumption important for this measurement?
That's what we measure for the indirect calorimetry.
Yes. So the most muscle metabolism is aerobic. Yes. So we can say the O2 consumption is proportional to the energy expenditure. Okay. We have this proportional word here. You need to mention this word. It's a keyword, proportional. Okay. We need to say proportional. Not exactly. It's not absolute, but it's proportional. Okay. And what does it mean aerobic respiration? How can you measure aerobic respiration?
What does aerobic respiration use?
This is what I think Shivani was explaining before.
Yeah.
Okay, so we have these things. Okay, aerobic respiration and anaerobic respiration. And someone was explaining about the systems, right? We have the phosphocreatine system, the glycogen system, yes, and the O2 system. This O2 here, aerobic respiration. So these two, phosphocreatine system, glycolysis system, number 1 and 2, and the aerobic is number 3. Yes?
I think it answers Shivani's questions, right? That's what the question was, I think. What is the stages of
yeah,
use?
guys, like my internet connection is super bad.
Okay.
So I'm like
Okay.
listening here words. I'll listen to the recording again, and if I have any questions, I'll come back.
Okay, so what you were asking before is when. So onset, when do they start? And time to fatigue, how long do they last? Yes. So the phosphocreatine system, phosphogen system, it's immediate, it starts immediate, and it lasts only 10 seconds. The glycolysis, it starts less than 10 seconds, and it lasts for 1 minute. Everything else is aerobic. It starts from less than 3 minutes, and it's unlimited. It lasts forever, okay? Yes? So that's what you were asking before. This less than 10 seconds and less than 3 minutes is actually here as well. This is the anaerobic respiration. When do they start? Okay. Shivani? Aish?
Does it answer your concern?
Katie? Anyone?
Guys,
Yeah, understood.
Okay. There is one source of energy that is missing from this table. Which one is it? Which one is it? So I explained number 1, 2, and 3, yeah, from these things over here. To make energy. There is one missing. To make this energy. Yes? So from here to here, there is something that is not in this table. Does anyone know the answer? Okay, so the answer is basically this one over here.
ATP.
Yes,
Yes,
ACE,
good.
that's right, ACE,
Good
ATP.
job.
So 1, 2, 3, and 4. Don't never forget about this, okay? This is your store, ATP store. ATP is not created only on demand, it's created all the time. So you have it there, okay? ATP stores inside the cell itself. Never forget this one over here, okay? This one, don't forget it. People just memorize 1, 2, 3, which is these 3 things, but they forget ATP. Don't forget ATP, okay? Because we ask about energy. So everything coming before this, all of these things are actually energy stores, okay? Never forget the ATP concentration stores inside the cell itself. What is indirect calorimetry? Okay, and I underlined the word calor. This is bonus for 3rd year. Okay, you don't need to know it, but if you learn it now, it's good. What does it mean, calor? You know, calor. What does it mean, calor? Dolor, bor, tumor. This you need to know are the only Latin words you need to know in your life, basically. Okay, for 3rd year. And one of them is calor. Yeah, heat. Basically heat. Yes. So these are for inflammation. You are going to learn next year. So heat is the calor. Okay. So when we said calorimetry, it means measure the heat. Okay. All the other terms here, you can find them here: redness, swelling, pain, whatever. But calorimetry is for heat. Okay. So now that you know what calor means, what do we measure in direct calorimetry? When we say direct calorimetry, what are we measuring? Come on, it's
Directly
easy.
heat?
Yes, directly the heat. Good. So if we say indirect calorimetry, what do we measure? Not the heat. It's indirect, not the heat, right? So there is an equation that gives us what we measure and the heat, and it's this equation over here, okay? Substrate plus oxygen gives heat, carbon dioxide, and water, okay? This is how we make energy. Heat is going to be measured for direct calorimetry. Yes, that's what the heat. And oxygen and carbon dioxide will be measured for indirect calorimetry, okay? This equation, you should know it already from high school, like how the plants do it or how we do it, you know, like glucose plus oxygen equals carbon dioxide plus water. Or if you reverse it, is how the plants make energy, you know. The sunlight plus carbon dioxide plus water makes glucose. It's like the photosynthesis, the reverse, okay? So this equation is pretty important, it's really simple, but if you can use it to explain direct and indirect, okay? It's very simple. You say direct calorimetry, we measure the heat. Indirect, we measure the heat again, because it's calorimetry, we measure the heat, but we calculate the heat, but with not measuring the heat. We measure oxygen and carbon dioxide, and we calculate the heat. Both of them have to do with heat, with calorimetry, okay? Both of them have to do with calor. But the one is direct on the heat, and the other one is indirect, okay? So this one over here is a student, is a patient, making some work. There is heat produced from this patient going to this machine, which is insulated. Insulation means that the only heat that goes in this system is from this person. External heat will not reach the sensors. Plus, all the heat that goes there will go in the sensors, they will not go away. So this is actually the direct calorimetry. We measure the heat, directly measuring the heat, okay? Direct calorimetry. This one over here is the indirect, okay? How do we do it? Oxygen, carbon dioxide, okay? Now, water and substrates. We don't need to know these things, or do we need to know these things? How can we measure it? If the water is found in your muscle, in your body, the metabolic water, if the substrate is, okay, we don't know inside the cell what was used, fat, carbohydrates. So we cannot, if we cannot measure these things, how can we estimate the heat if we just measure oxygen and carbon dioxide? And the solution to this is what Panchul explained, okay? If we cannot measure these substrates and water, if we cannot measure this, we're going to use an estimation. And this is exactly the most important slide that Panchul was explaining for the physiology of exercise, all these calculations, the RER and RQ, yes? And because we said cellular level, the RQ is cellular level, you need to take the blood, but we're not going to take the blood in our experiment. So we're going to use the RER, okay? In our experiment, we use the RER because we do indirect calorimetry and because we cannot actually measure the substrate. We cannot actually measure it. So we measure the oxygen, we measure the carbon dioxide, and we use the assumptions, these calculations, to approximate the substrate. Okay, it's like an approximation. That's why it's not as accurate as direct, but it's the best we can do. Non-invasive with the RER. It's approximation. We use a mean, the mean for 1 liter, the mean. And this mean is based on the percentages. This is actually from 4th year, the hygiene. It explains how many energy you're producing from 1 gram of protein, 1 gram of carbohydrate, 1 gram of fat. This is what Panchul explained before, okay? So this you already need to know in 2nd year, okay? You already need to know how much each gram is producing and that it's based on some percentages, like the perfect diet should be so many percentage of carbs, so many percentages of fat, so many percentages from protein. And then we take an average and then we take this over here, the approximation, okay? This approximation is about our substrates, okay? So you do this equation in your exam. You explain the direct calorimetry, you explain the indirect calorimetry, and then you jump to the substrates. You have to explain these substrates because they will ask you, how can we know the heat if we don't know the substrate? And then you have to say, look, we're going to use an approximation. We're going to use the RER. We're going to use these kilocalories. It's the mean. It's based on the averages. It's based on the averages of the normal diet. And the key word, you have to say the word proportional. The word proportional, okay? It's a key word. Proportional, proportional, proportional. That's why we are able to do indirect calorimetry, okay? We have here also the ratio, optimal ratio. So you say the ratio, the calculations. This is what Panchul explained. And this is all because of the substrate, okay? So this equation, draw it in your exam, explain it, explain oxygen, carbon dioxide, substrate, explain the substrate by this over here, the equations, done. Indirect calorimetry done. Everyone okay with this? Yes?
Yes.
Okay,
Yes.
and also remember that when you explain these equations, they may jump to RQ, okay? What is RQ? Why we use RER? And you say what Panchul said, because RQ is by blood, okay? It's invasive. Done. The whole experiment about value of metabolism done. So we explained the value of metabolism, we explained the performance, which is based on the W170. We explained why 130 and not 170, because it's uncomfortable. We explained the heart rate, the ECG, and now we have only the systolic and skin, these 2 things left, okay? So next question is, how do we get the systolic and diastolic pressure?
Think of manometer.
So basically, the sphygmomanometer, there is the automatic version and there is the manual version. What is the golden standard? Which one of them? The manual or the automatic? Which one is the gold standard? Gold standard?
Which one is more accurate?
More accurate. Gold standard is what? Which one? Automatic or manual?
I think manual.
Yes, manual. Okay.
Exactly.
So from here in your exam, the examiner may jump and say, okay, tell me how it works. It's in the manometer. You know the Krotakov sounds. You know like how you measure the systolic, diastolic. You hear the sounds. Yes, you know all the things are from blood pressure. We explained all this. Okay. So from here they can jump to explain. You know the graph, systolic, diastolic. There is the sounds. It's like this graph. Yes, you know how to do it. Okay, from here, done with the blood pressure already. And then the last one is the skin temperature. Thermal homeostasis. This is what Panshu was explaining before. Okay, so how do we measure the skin temperature? Skin temperature. How do we measure skin temperature?
No, there's the thing that I don't remember the name.
Thermometer.
But
thermometer,
wait,
okay.
why was it not allowed the mercury anymore in Czech Republic?
Because actually I bought one yesterday. I don't know why they say it's not allowed,
Really?
but it's because it's poisoned. Yeah, I bought one, but it's because it's I think it's poisoned. Mercury is poisonous. However, you need to remember that if you go back to our experiment, where is the table? You see that you only have a short period of time to take measurements. Yes. During this time, everyone is running. They're going to be put the ECGs. They will put measure the heart rate, take the blood pressure, put the pressure cuff. So you don't have enough time to use this mercury or the other one, the thermometer. So what we will use is the infrared thermometer. Okay. We're going to be using the infrared because it's faster. It's really fast. And yeah, it's faster basically. And you know how it works, this infrared? Basically infrared, it's in the name. It sends, it reads infrared, the infrared radiation coming from the patient, from the student, okay? So it's based on infrared. It converts the infrared into temperature, the energy, okay? So remember, it's not the thermometer that you use at home when you're sick because it takes too much time. It takes like 2 minutes or whatever. We use this infrared, which is basically milliseconds. You just point and shoot, beep, done. It's like the supermarkets, when they scan the items. It's really fast. We use the infrared, okay? And from here, from the infrared, okay, they can go to biophysics a bit. How does it work with infrared? Because it's faster. But they can also jump to thermal homeostasis. So you have the superficial and the deep capillary networks, and how there is a sphincters. This will constrict, so the blood is shunted to the surface, so it can dissipate the energy. So they can jump to thermal homeostasis. Okay. Also from here you have the sweat glands. Yes. So you can also jump to the water, how it evaporates, because thermal homeostasis is actually a final exam question, and you need to know how the sweat and all these blood capillaries, they will actually make the thermal homeostasis, remove the energy from you, as well as the cardiac output, what Panshul was explaining before, cardiac output that is shunted to the skin and to the muscles and away from the kidneys. Okay, so you have the sweat glands, you have the capillary beds. So from this part, they can jump to thermal homeostasis or some biophysics in the infrared. Okay, that's the only thing they can jump from here. Okay, everyone okay about the temperature?
Yes.
And my question is, who creates temperature? Why do we create temperature in exercise? What is the source of temperature?
Because of the metabolism, you create energy at the same time. Like, since energy cannot be formed or destroyed, it needs to convert from one form to another. So you release heat energy as well.
Okay, so metabolism where? During exercise, where is the highest metabolism taking place?
In the skeletal muscle.
Yes, and during rest, where is the most metabolism, let's say, taking place?
I guess in the gastroenteric system. Because you need to rest and digest, no? That's why I thought.
Yeah, okay. But basically, the blood will go to the kidneys and to the liver. So kidney and the liver are actually actively metabolically. Mostly the liver, basically, because it has to do everything. It has to metabolize the drugs. It has to metabolize the hormones. It has to create the storage reserves, okay? So during rest and during exercise, you need to know that the metabolism is shifted, okay? So you need to remember that the temperature is coming from different places depending on if you're exercising or not, okay? So when they ask you, what is the source of temperature? You say it depends. If there is exercise, it's from the muscles. If it's not exercise, it's from like the liver, okay? Everyone okay with this one?
Yep.
Okay, and that's it basically. Keep studying. If you have any questions, you can ask now. How can you differentiate COVID-19 from other things? I'm done. But if you have any questions, we can go back.
Yeah.
We can go back.
Yeah, I have one question.
Yes.
Like sometimes Kovichak, for example, comes and like asks random question and he wants his units in like watts or hertz or stuff like that.
Okay.
So like, where should we, let's say, expect these questions or these units?
In ergometer.
Just in like what we were talking today.
What is the question again?
That like sometimes they expect or they want us or they want to trick us or whatever, so the answer will be in hertz or in watts or in stuff like that. So like if you have any insight on that.
No, basically there is two things. One is the ergometer, where you have to say it's for watts, okay? We're using watts for this experiment. And the other one is what Panshu was explaining with all the kilocalories and joules and all these things. You see kilojoules, kilocalories, grams, and this is not actually a trick question. It's not to trick you. It's to be able to convert the units, because some people use grams, kilojoules. Some people use grams, kilocalories. Even if you open the nutrition in the supermarket for each food, if you turn the back, it says, "Oh, this food is so many kilocalories," or "It's so many kilojoules." So you should be able to convert these units. So it's about unit conversion.
Yes,
okay?
Yeah, but what I mean is like he even asked it, I remember last semester with the membrane potential, is like how much action potential is generated in hertz or something like that. And like it's so random, like how, like what, you know?
Maybe Panshu can answer this.
Honestly, hello, can you hear my voice?
Yeah.
Okay. I to be honest, even I would not know the answer to that. The only question, I think the only answers can be given is by him only.
Yes, and try to use common sense and logic. Try to see what he's trying to ask you.
See,
because when he asks you a question, he has the answer in his head already. You know, he makes a question based on what he wants to hear.
But what you can do, this is what I did, because I was asked questions throughout the second year. What I did was every question he asked me, I note down the question. And in the end, I had him for my finals itself. And he asked me repeatedly the same questions again. So maybe whatever questions Professor Vlad asks you, just write it down and then try to figure out the answer at home. One, you will know how to answer that question. You will know how to answer.
We have half a semester left, and you tell me now.
I know. It's a little bit too late. I'm sorry, but
so this is a physiology. Is about critical thinking. So he will ask a question, and he's expecting you to explain something. And if you don't explain it, he will answer to your answer. He will say why and why.
Yeah, exactly.
So why, and he will keep saying why until you actually explain.
You get the answer. Yeah.
Yeah. So the number one question they will ask is why. So if he says, for example, what is 1 gram of protein in kilocalories? You cannot just say 4. He will ask you, and why, and why, and why. You're going to say, okay, 1 gram, it means this kilojoules. You say, and why? 1 kilojoule translates to this many kilocalories, and why? You know, like So you have to explain it. So 1 gram means this many kilojoules, which converts to these kilocalories because of these. It's not simple answers. You need to show that you understand it. So you cannot just cheat on this. You know what I mean? If they ask you something, you just say one answer. You have to explain it. That's why the number one question is why.
I think the best way to approach this is by noting down the questions and trying to figure out, because once you figure it out, I feel like there's a pattern you learn in his questions. Like he always asks for a specific thing in it, and then for the next question will be something similar to this. Just try to note down his question, try to understand what he's trying to always ask in the whys and everything. But you don't have to worry about it too much also, because it's not gonna be like pass or fail or something. It'll be like if you want an A or something, then he will ask you these questions. He will not judge you, or like he will not judge your B and C with this. These questions are too hard to answer like on spot. You have to have previous knowledge of them to be able to answer them. I think I get what you mean,
because like when it comes to calories or to joules, like I understand, but then I remember him asking it like with
the Hertz thing, even I wouldn't know.
Potential and stuff like that, and I was like, oh, what the fuck, you know?
Yeah, trust me, I know what you mean. I had to go through it.
Okay, thank you.
No problem. Any other questions?
Are you guys planning to make another session?
If you guys want to, we can. Do you guys want to know for any specific topic? Maybe Stelios, do you think we should make another topic?
I was gonna follow the schedule. Like I have all the like the topics kind of prepared, so I'm ready for anything.
Okay. Okay.
Currently, we don't hear you.
Who, me?
I think that if it's okay with you, and like probably chances are that they are going to ask it on the final. So if it's okay with you, like I would like to participate in your lessons.
Okay, for sure. But you have which? Okay, we'll follow the schedule then, and we'll make present. I have to actually make presentation. I will need time because I have to make the presentations from scratch. So I will try to do them before the actual before the schedule before it happens for you in the schedule. Is that fine?
Yeah, because I mean, like, well, obviously simulation, there's nothing you can do about it. But like, there's a few topics in the list
there is
that
so much
we
background
probably are.
noise. I can't hear anything.
Do you have a specific topic in mind?
I don't know.
No, like just the laboratories that are left.
Okay.
You know, like the other senses. I think there's a laboratory. What else there is? I saw anesthesia, but I'm not sure if we did it or not.
We did a sim on it. I don't know if there is a lab anesthesia simulation we did.
Wait, let me check. I will just quickly look.
Yeah.
Okay, so a quick sum up for this one. We're going to send you the presentation, okay? So important things you need to know is the definitions. Everything Panch will explain, all these definitions, okay? Definitions, how the values change. This one, RER and RQ, important, there are differences. The calculations, and I explained to you why, is because of the indirect calorimetry, okay? All the gases, important. Remember all these values, yes? Swimmer at my, no, not this one.
No, not this one, yeah.
But this one, here's values. You need to know the adaptations. The most important, stroke volume doesn't change, okay? Cardiac output is stroke volume times heart rate, okay? But when you do this multiplication, this is the cardiac output, right? This times this, this times this. And it increases because of heart rate, not because of stroke volume, okay? This is important. The calculation for maximum heart rate, you know. The blood flow changes, all of this graph, okay? You should find the percentage of cardiac output, okay? Learn the percentages of cardiac output. I don't know if it's good to learn the ml per minute.
It's better to learn the percentage because it's much more generic, because cardiac output can be different for different person, yeah. But a percentage of cardiac output will be a little bit more accurate, and I think Professor Vlad will prefer you give him a percentage instead of a specific value. I don't think he likes one values.
So important for this is that brain and heart don't change. Skeletal muscle and skin change. Why? Know the why they change. We have the acidosis, we have the thermal thing. Kidney is less because it's there is a high capacity, okay, abdominal organs, okay. So this is important. You should know all the values, of course. The two mechanisms, one is the neurogenic, yes, the neurogenic anticipation. The other one is the cadet, the hemoglobin. Important for hemoglobin is that it's the tissue that decides how much it will absorb, okay?
Exactly.
So that's from the hemoglobin lecture, seminar. Thermal and endocrine, this is for your final exam questions because they can jump. Thermal, they can jump on it based on the thermometer. Remember, I told you. Endocrine, you should know about it because they can ask you all this cortisol and stuff. This O2 depth and epoch, read this, okay? You should read this and understand why, what's the difference. This is the most important thing, okay? How many times
and you should understand the why. The why is quite important, actually.
Why? We're talking all the physiological mechanisms, okay? All the physiological mechanisms that make it, like how they are doing. So how and why. How is the mechanisms, and why is why do we need it? Okay, why do we need more VO2 max? Why do we need cardiac output? Why do we need heart rate? Okay, so why we need it and how? What are the mechanisms? And you should know all these values here. Okay. This test, okay, we just said if you do the understanding, just know the theory behind it, just the theory. Just the theory. 3 terms, what is lactate threshold, what is ventilatory threshold. This is your final exam, okay? Like know where are the chemoreceptors, what do they do? VO2 max. Make sure, understand it's not about ventilation, it's not ventilation. It has to do with oxygen consumption, okay? Oxygen consumption. And it varies on different factors, especially heart rate and SV max, okay? So not ventilation, don't confuse. Someone with a lot of big lungs and breathes a lot may have less VO2 max than someone who is small and actually exercises, okay? Yeah, the experiment. Know the experiment because they will ask you, and what did we do in this lab? We did this thing, we did this thing, we measured these things, okay? How? You say the experiment, the instruments, we use this, we use this, we use the ergometer. What is ergometer? We have the watts, the ergometer, okay. We can extrapolate, We have all these QT, QRS, PQ, HR. You need to know how they change, okay. I need to find the answers to this. Some of them become lower, some of them stay the same, some of them increase, okay. We need to find the answers to this. I will send it to you. We have the metabolism, indirect metabolism. We have the keyword proportional. Remember this keyword. Remember aerobic is a keyword. Remember how we create energy, and don't forget ATP. ATP is found before energy, so ATP is important. Don't forget it. What is calorimetry? Remember calorimetry. We have the direct, indirect. So basically, if you just draw this equation and use the substrate to jump to the food. Okay. Use this substrate over here to jump to the food, explain RER, RQ, equations. The pressure, we're going to be using this. So revise everything from blood pressure, Kolokov sounds, how we measure it. There is a graph where you inflate the cuff and then you deflate it. And then you have the like systolic, diastolic, and then you have the sounds, right? You remember this one? Systolic, diastolic, you hear the first sound, second sound, all these sounds. Revise how it works. And then the temperature, just look a bit how the infrared thermometer works and all the thermal homeostasis. It's a question in physiology. It's called thermal homeostasis. It has to do with sweat glands. It has to do with the shunting of capillaries, okay? That's basically what you need to know about this laboratory. So I hope everything is clear. And go back to the list. Remember I sent you a list on WhatsApp? Go back to the list and see if you can answer all of these questions now after the lecture.
Yeah,
and
that's a good idea.
It's recorded as well, so you can actually see the entire thing if you're confused. Everyone okay?
Yeah. So I checked the list and it's just like hearing and reflexes, I think, left. So.
Yes.
Yeah, but can I ask something?
Yes, for sure.
Like I know it's not so much like maybe your guys' job, but last semester the whole time through GIT we were preparing for genetics, and like if you don't mind, like maybe doing like a session with like even question answers or stuff like that. It would.
Or GIT, what do you mean?
She wants to redo the GIT, I think.
But there was no GIT. There was GIT?
I think
There's
there
not
is
a
one
but
seminar, maybe. In my time, I had a seminar.
Arena.
yeah, I asked Vlad and they said that they don't do it anymore. But then
You mean the
okay.
ANS? ANS. It's ANS. It's ANS. It's not JT. So
no,
basically, the
maybe
ANS,
they're kind
sympathetic
of together.
parasympathetic. Yes, they go together. So basically, the ANS is about sympathetic parasympathetic. And how are we going to see the effects of parasympathetic sympathetic? We go into the GIT, because like GIT is greatly influenced by sympathetic parasympathetic. So basically, the experiment is called ANS, not GIT. Yeah.
Or if you have stuff out, you could send it to us, maybe.
Okay, we'll have a look, because I have to check what resources I have on it, and we both will, I guess, then discuss on it and then let you guys know. Yeah, is that fine?
Yeah, awesome. Thank you.
Yeah, that's good.
No problem. No problem. I have a document in which the segments, the changes in the ECG are there. I'll send you that, and it has the whole summary in 2-3 pages plus any points the teacher mentioned during my class. So I'll send you that, and hopefully it help you. Yeah.
Thank you so much.
Yes, thank you.
No problem. No problem. Okay,
Any
guys.
other questions?
Yeah.
No.
Any other questions?
Okay.
Do you guys have any idea about like when can uni open? I'm sure you don't know, but I just want to know.
When can we?
When can uni open, or would like do you have any idea?
So basically, there is a problem with people that left. When they come back, they cannot go to the exam because they have to stay 14 days at home. So to solve this problem, our university said, you know what, we are going to offer online exams. So we have the online exams, and anyone can choose. Even people that stayed here, they can choose, I want an online exam or in-person exam in case the uni opens. Now, in case the uni opens, I don't know if there will be attendance or something. It's going to be a bit complicated to go back to normal. So first we need to see what the government is going to do. Then we need to see what the department is going to do. So yeah, it takes a lot of planning, and no one can tell you right now what's going to happen. We just know that the first say is the government, the second say is our dean and rector, and then the third say is per department. So for example, maybe they say the uni can open, but the department says, you know what, we are online, we're going to continue online for people that are not here. Instead of doing the lesson twice for people that are outside the country and the people that are inside the country, maybe they say, you know what, let's just do everything online so we don't double the lessons.
Okay, thank you so much.
So no one knows. But even if the uni opens, maybe they continue online. So it depends on department, depends on the dean, depends on many things.
And
so
if
what
anything,
I suggest right now is just keep studying as if you're going to do the exam online. Okay? Because that's for sure. There will be online exams.
Do you think it will be better to do, like, if I am here and I have a choice, like, what would you have chosen, to go physically or to do it online?
I am also here, and the thing is, if you do it online, you go into the uncertainty because it was never done before. Maybe some people, they pass and they say, you know what, we found some technical problems, so everyone who passed has to do the exam again or something like this. Or we found out that people cheated, so everyone that passed online is cancelled. So you go into the uncertainty part. So for example, as you don't have time to prepare. So for me personally, I want my time to prepare, like to put my brain into an order. So me personally, if I'm
yeah. Okay, thank you so much.
Okay, thank you guys.
And I hope to see you soon, and take care.
Yes, you too. Bye-bye.
Bye. Thank you.
Thank you guys. Bye.
Bye.
Have a nice Easter.
Thank you. Bye.